Why facelift and fat grafting? Why not just do a facelift as we traditionally have? And the answer to that question lies in the multifactorial origin of facial aging. When I meet with patients in consultation, I say you're aging in three categories. The surface of your skin is aging, things are sagging, drooping, becoming loose and redundant, and your face is undergoing a process of hollowing medically known as atrophy. Our skin care and skin resurfacing procedures address that first category. Our traditional facelift procedures address that second category. Fat grafting allows us to treat atrophy, something we couldn't do in the past, and in fact, the missing link in facial rejuvenation. So here's a patient seen at age 22, age 61 after she's had a skin-only facelift, and age 63 after a SMAS facelift. We can see that the skin-only facelift failed her. She still has elderly facial contour, and that the SMAS facelift has improved that situation. Her face is closer to her preoperative condition contour-wise. But has lifting fixed everything? And the answer is no, lifting doesn't treat atrophy. Look how full her upper eyelid is, look how full her temple is, look how full her infraorbital mid-face area, her cheek, look how full her lower lip is, how plushly padded her cheek, jawline, and neck are. And look how hollow and deficient those areas are in the after photo. So how do we treat atrophy? And that's fat grafting. It's not possible to go from that before photo to that after photo without restoring lost volume. So the advantages of doing fat graft with your facelift is it's a more comprehensive treatment of the aging change. We're treating all three categories of aging, not just two. It's a volumetric rejuvenation. This is a new dimension for us to work in. Traditionally, we were two-dimensional tailors. Fat grafting makes us three-dimensional sculptors. It's autologous, it's long-lasting, and produces a sustained improvement. And there's a now scientifically proven stem cell regenerative effect, which actually is the focus of this meeting. Are there disadvantages? Yes, there's a learning curve associated with fat grafting, just like all procedures we do. It will increase our time in the OR. Our patients will have more swelling, a longer recovery. There's some uncertainty about the exact outcome, and we have to overcome patient and physician misconceptions about the fat making the face look fat or migrating or being lumpy and so on. But a summary of my treatment philosophy is combined facelift and fat grafting work synergistically to treat two different problems. And the two procedures performed together will produce a better outcome than either procedure performed alone. Fat grafting represents the most important new advance in facial rejuvenation procedures since the introduction of the SMAS technique. And despite what we thought in the past, lifting can't correct all aspects of the aging change of the face. So when do we do this? Do we do it at the beginning or the end of the procedure? I like doing it at the beginning. Why is that? Well, I like to harvest the fat in the morning before the patient's face is prepped and draped. The patient's typically in a deeper plane of anesthesia in the morning. There's a lack of facial swelling.